who has spent time as a patient in a hospital knows the feeling of vulnerability that comes with being dependent on others. People trust that caregivers, managers, and administrators will protect their privacy and safety while upholding standards of care. But these are not just the desires of patients and their families. These are fundamental rights.
So it's really an issue of trust that when you put on that hospital gown, that you are going to be telling the health caregivers many things that are intimate, that other people may not necessarily know, and that could be embarrassing to you.
The major codes of ethics for nursing throughout the world stress the importance of patient privacy, safety, and maintaining standards of care. The American Nurses Association puts a special emphasis on these rights in the third provision of its Code of Ethics, which will be the focus of this program. This provision states that the nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. Nurses are often in the best position to advocate for the rights of their patients and are frequently involved in key ethical issues and ethical decision-making processes.
They are patient advocates. I mean, it's very clear that one of the responsibilities of nurses is to protect and advocate for their patients.
The right to privacy is a basic one for patients.
If you want to keep your living arrangements private, that's just fine, Mr. Miller. Admitting doesn't need to know the name of your roommate, just your address and phone number.
The need for health care does not justify unwanted intrusion into the patient's life, and the nurse safeguards this. This includes maintaining an environment that provides sufficient physical privacy.
I'll let you go ahead and put that on. Let me know if there's anything else you need, and I'll go ahead and give you some privacy.
This is not always easy, especially in busy hospital environments. Auditory privacy for discussions of a personal nature may be necessary.
Of course. Would you rather talk about this privately? Because we can arrange that.
It can be very hard in a hospital setting to provide that privacy. And that's been one of the big patient complaints always.
Which becomes very difficult when you have a room with two patients in it. The other patient is going to hear things about the roommate's condition. If there's an important conversation that needs to happen, it may need to happen outside of the room.
Another example would be if they're bathing themselves next to the bed and you have the curtain drawn and maybe the door is closed, you want to knock on the door before you go in.
As a means to protect the right to privacy, a nurse has a legal and ethical obligation to maintain confidentiality of all patient information. This ethical emphasis on confidentiality is as old as nursing. In Florence Nightingale's famous Notes on Nursing, she wrote, "And remember, every nurse should be one who is to be depended upon. In other words, capable of being a confidential nurse."